Welcome to Season 5 of Purposeful Empathy, a show dedicated to amplifying the voices of people from around the globe who understand that the world needs more empathy and are doing something about it. Today's episode was brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching the show. Enjoy. Welcome to a new episode of Purposeful Empathy. Today I'm joined by Dr. Ashok Bhattacharya, who is the founder of the Empathy Clinic. He is trained as a psychiatrist and specializes in psychotherapy for people with post-traumatic stress disorder. In addition, he has a strong interest in couples and marriage and has developed a technique that he calls colourpathy to assist marriages that are struggling and improve ones that are already good. He sees every individual as connected to others. His practice emphasizes empathy individually and in relationships, whether it's at home or in the workplace. And after 35 years in private practice, he is committed to getting the message out that empathy is a teachable skill. He's also the author of 2 books, Deep Fried Nerves and Cake, a guide to reciprocal empathy for couples. On a very personal note, he's been happily married for 35 years, has 3 adult children, 1 grandchild. He's also a musician who works out 6 days a week and practices empathy every day. Welcome to the show, Ashok.
Thank you so much, Anita, for having me. And thank you so much for making the time, even though you're overseas right now. So it's just a joy to connect with you.
Fantastic. And I was saying just on the pre-call, it's amazing that we are like neighbors, Canada neighbors, and that we haven't come across each other. But, you know, timing is everything. So it's meant to be that we meet for the first time now. And I'll start with a really basic primer question. How do you define empathy?
Empathy is trying to experience the thoughts and feelings of somebody else from their point of view, not yours. So true empathy requires self-negation. So when someone uses the phrase, think of it as if you were in their shoes, that, according to me, is wrong, because that is you in their shoes, not them in their shoes. And I remember when I came back from India and I was driving around in Newfoundland, where I was living at the time, saying, I have no idea how to put this all together, because I was in this one place. And it's like me saying that my experience of that would be the same as your experiencing of going to a pedicure after you came back from Rwanda. You have to ask specifically about that person's experience to empathize. And so that's what I think, what I actually describe it as. And my other way, which is a quick example, is the sound of our voice. So if I told you, Anita, I know how your voice sounds. You say, well, yeah, I know how it sounds on a recording, but you don't know how it sounds to me. Because when I listen to myself, that's not how I sound to me. So empathy is trying to listen to how someone's voice sounds to them. That's the difference for me.
And so obviously empathy is really important in psychiatry. Maybe you could share it's not important to psychiatry? Oh.
So I'm an anti-psychiatry psychiatrist. And, you know, I love being a psychiatrist, and I love my colleagues, and I go to conferences, but I go to conferences and get disappointed. So for a couple of years in a row, I've tried to teach an empathy course at my Canadian Psychiatric Association. They've rejected it every year. And I was actually at a conference, and I asked them in a group in a Q&A, is empathy teachable? And about 100 people in the room, they laughed. They thought that was a funny thing to say. And I'm thinking, these are psychiatrists, these are doctors, these are people who are trained in understanding the experience of other people. And I've known this for a long time. I've had problems with understanding, explaining, and experiencing empathy really my whole life, but it became acute when I started in medicine. And I realized that empathy really isn't on the table. Like, we're not taught empathy in med school. We're certainly not taught empathy in psychiatry. Now, that is beginning to happen now, because as you've said, there is an explosion of empathy research happening now. So I'm really happy to hear that. But the main reason why I stand up my clinic and call it, the Empathy Clinic, is I use empathy to diagnose and treat people. And a lot of, if I spoke to other psychiatrists, they may not be as interested in that particular process. They might be more interested in, what's the diagnosis, what medications are you using, and what are the efficiency and effectiveness of that. And that's solution kind of psychiatry, but it's not necessarily experiencing the experience of your patient or your client to know what they're going through. And I use the headache example to make this clear. If someone goes into a doctor's office and says, I just have a splitting headache, and the doctor says, well, okay, well, let's do a few tests, and here's a medication for that, and that person goes away. That's a perfectly reasonable physicianly experience. But another thing to do is, what's going on in your life? What's going on in your relationships? What's going on at work? How much stress are you putting on yourself? How much stress are you feeling in your life? And so the answer of that headache is a bigger answer than let's look at it symptomatically and then come up with a treatment for the actual headache. And to me, that's the empathic question. How are you and what else is going on with you?
I remember having a conversation with a new healthcare provider via a consulting company who they were trying to do more at-home visits, which is kind of like bucking the trend, really. And they recognized that just being in the home environment of a patient, they see so many layers of context that really brings to life why somebody might be suffering from a particular condition or what may have brought it about. So you're really looking at a whole person, like you're looking at the psychiatry of a person through a holistic lens. Is that what you're describing?
Well, I am describing that. I see that I kind of look at the universe and then kind of the planet, the creatures on the planet, and then kind of human beings. I kind of look at that way from my empathy perspective. And I like what you said in one of your videos where you're looking at Maslow's realization that transcendence, really, you have to get out of yourself to truly empathize. If you're just thinking about yourself, then we call that narcissistic. And as we know, people who are narcissistic are so saturated with their own feelings and thoughts and experiences, they can't empathize as well. Now, I treat a lot of narcissistic people and teach them how to be more empathic. And when it works, it's amazing. I mean, those are sessions I cry after because someone's actually learned how to be empathic who we thought was not capable of that. But to me, empathy, it requires a certain level of selflessness, a huge amount of curiosity, a capacity to be a little bit vulnerable, and then let yourself enter somebody else's experience, but not as you, to try and experience their experience from their perspective. And it gets even more complicated when you're empathizing with other creatures like sperm whales or dogs or cats or ants or worms, which is, I try to practice that all the time. And people look at you real funny. What, you're trying to empathize with an ant? You bet I am. I'm trying to imagine that ant looking up at me and just guessing what that ant might be experiencing. And I think that's what I try to do. I try to get out of being myself and try to enter that experience as that other person.
So two questions as a follow-up to that. One is, what do you think informs your particular perspective on the way you serve your patients? And this idea of seeing empathy for life across the entire spectrum of life, is that informed by some kind of spiritual tradition or some philosophy that you have? So that's one question that I want to follow up on. But then I wouldn't want to lose the opportunity to talk about narcissists for just a moment, because typically when in a presentation, I'll say, we're all born with the capacity to empathize, and there are two outliers. There's the psychopaths and the narcissists, and then there are people who have, are neuroatypical and are on the spectrum sometimes, and they empathize in different ways. So I usually don't include those in that generalized statement that we're all born with the capacity to empathize. But now you've talked about narcissists, and you say that you've worked with narcissists and you've helped them develop the capacity to empathize. So I'm wondering if you could speak about that for a few minutes, maybe share a couple of insights you've had or revelations or experiences.
Well, first of all, when we talk about psychological conditions, whether it's in the DSM, which is this document here, that's all the diseases you're allowed to have in psychiatry. right? So that's actually that's kind of a terrible way to look at it. If someone has something that's not in that book, what do they have? And so every 5 years they republish this thing, and there's new. Some things get taken out of it, some things get put into it. For example, homosexuality used to be a psychiatric disease. Post-traumatic stress wasn't a psychiatric disease until 1980. So it's and it's not even a psychiatric disease if we want to get into that. So I think there's a spectrum, especially in personality. A narcissistic person has a bunch of symptoms that they will unwittingly express to people, and people will experience in that way. But when I work with someone who has narcissistic personality, it's a bit of a bloodbath, the first 3 or 4 sessions, because what I have to do is I have to dismantle the narcissistic symptoms. I have to take them apart to get to the curled up, terrified, insecure person inside. That's the person that needs the help, because narcissism is defense against insecurity. So if I have the narcissist side of that person in the room, the hologram, and I'm giving the treatment to the hologram of that person, the big shiny hologram, that's not going to work. I have to get the person inside that this adult person is defending, get that person in the therapy, say, it's safe, it's okay. Let's talk about why you're feeling so insecure. Let's talk about why you need these defenses. And about 20 to 30% of the cases that I work with narcissists, if the person doesn't leave because I'm too difficult to work with, they change. And I know they change because they come back crying and they say, I can't believe it. I was downtown yesterday and I saw someone, who had no money. I reached in my pocket and gave them, $50. They looked up at, and I said, I just wanted to help. Now, technically, that's not necessarily empathy. That's compassion and kindness. But they're thinking now about somebody else besides themselves. And that, to me, is a process of encouraging that person to think of otherness. Think of otherness. Take yourself off the screen, start to think about otherness, and that's what creates the change. That's my kind of narcissistic treatment process.
So you must look around in culture and see narcissists all over the place. There's one that was very powerful up until recently. It continues to be powerful in a different way. Do you still think that there's hope for salvation for him? Should we have empathy for narcissists?
Well, I don't necessarily say that we should have empathy. If you were watching me work with a narcissist, you might say, oh my gosh, he's being very brutal. Like, go easy on that person, even though they're narcissistic. You shouldn't. But I tell my narcissistic clients in the first couple of sessions, look, I think you have narcissism as an issue. I'm going to be very, very hard on you, and you're probably going to leave in a few weeks or after a few sessions. They kind of look at me and say, what? Because now they're being challenged. And if I can get them through that dismantling process, so I can get the person, the version of them that actually needs the therapy, they stay. And so it's, am I going around diagnosing society all the time? No, I'm just a person too, looking. I meet people who have narcissistic symptoms or traits, but not everyone who is narcissistically described is narcissistic. Heck, I've been called narcissistic, plenty of times, because I'm always ranting about my platforms and people think, who does he think he is? And some of my ideas are a bit contrary to, for example, my own colleagues who talk about post-traumatic stress and some of these things, I think, somewhat incorrectly. So what is narcissism? And well, I always think of Vincent van Gogh. If you were driving past a field and you saw this crazy guy doing this crazy art that no one buys, muttering to himself with one ear, would you think, wow, this guy is going to change art? And what Vincent van Gogh is, he put feelings and images together. That's what the French Impressionists did, right? They put feelings into their work. And because people weren't comfortable with that, because they were empathizing not just with the visual, they're empathizing with the feeling that they were having about it, and trying desperately to put it on canvas and saying, what do you think? And people said, it doesn't look like a tree. And so how painful it must have been for him to be in that field painting away at 3-4 paintings a day, and people would stop and just throw stones at him. So I think, was he narcissistic? And if he said one day I will be a famous painter, well, absolutely not. But in his time, he might have been seen that way. So I'm always very careful when I think about calling someone a narcissist, or if they're going through a moment when really society is alienating them, and they may have a sense or a platform, an idea, like all the great inventions. A lot of them were diagnosed as crazy, like Galileo, put on house arrest for the rest of his life because he came up with something that we all now know is true. So I better let you ask me another question, or I'll go on too long.
Well, I'm finding this fascinating. Of course, the person that I had in mind is Trump. And I always get the question, when I give talks, how can we empathize with somebody who is, tyrannical and narcissistic and mean-spirited? And what you said at the front end of this is that a narcissistic person is suffering from, what were the words you used? But like what
insecurity. Narcissism is a defense against insecurity. That's right.
And so that insecurity is born from some place, either rejection or abandonment or something fierce that really, kind of grips your psychology in a way. So in a way, narcissists really deserve empathy because they are struggling so fundamentally.
Well, I think we live in a culture that values success and power and money and expensive things. And so when someone is narcissistic, if you read the history of Hitler, for example, I've always been fascinated with this relatively average guy who ended up running an entire country and getting people to kill millions of people. What he was able to do is he was able to be impressive and humble at the same time in the beginning. And as he got more and more power, people wanted to be part of that upswell of his power and his popularity. And then more people came in and more people. And so in the growing phases, everyone wants to support that person who's big and shiny. In the down phases, it's really hard to go to Germany now and find a Hitler supporter, like really hard. Because once their empire crumbles, nobody wants anything to do with them. And that's the narcissistic curve that goes up. It reaches a pinnacle and then it goes down and it devolves into chaos. And Hitler shot himself eventually because he didn't want to face the truth, because the truth was that he wasn't what he thought he was. And that's what narcissists try to do. They hide the truth, which is you might be good, but you maybe not as good as you say you are. And that's what they're always trying to defend against.
So as somebody who's kind of a political junkie, I'm just going to ask as an aside, who knows if we'll stick this into the conversation, but do you believe that Trump will see the downward curve and face that reality? I mean, there's a lot.
I'm actually not going to talk about Trump on a public forum because the last thing I need to do is to get sued by his people. But I will speak generally. All narcissists eventually crumble. You look at the history of any whether it's like a narcissistic culture or a narcissistic individual, it's an arc. I try to hasten that and get them when they're falling and say, look, there's another way to be. You don't have to defend using all this just be. And let's help this insecure person inside of you. And that's the transformative moment. And I've cried after sessions, maybe not in front of my clients. I do now, actually, but because it's so amazing to watch someone who's basically a social write-off be able to be right on and begin to write themselves into culture and change their way. And sometimes people don't believe it. But as they change, people begin, oh my gosh, this person is a thinking, feeling, empathic human being.
Okay, so now we can circle back to the other question that I had in response to something that you said earlier, which is you were talking about that you empathize even with the ants. And so I guess the feeling I had was that there must be something that animates that for you. And what is that? Is that faith? Is that philosophy?
Well, I'm not sure if I would call an 8-year-old a philosopher. But I've been who I am since I've been about 8. And I did have a big medical problem as a child between the ages of 6 and 8. And if you've ever seen Forrest Gump, where he has all that tin stuff on his legs, that was me. I had all that tin stuff on my legs. And I was born in England and grew up in England at the time. And I had a limp and went to the doctors. They said, he either has bone cancer or tuberculosis or whatever. Turned out I had Legg-Perthes. And that means that for 2 years, I had to be in a hospital for 2 months. And then for 2 years after that, I had to have all this stuff on my legs. Now, I was a soccer player. I loved playing football with the lads. And the minute I had all this stuff, I was stuck, guess what, with the girls. And I discovered at 8 that girls are an incredible source of empathy. When the boys wanted to get that ball in the net, the girls wanted to talk and socialize and understand how each of them felt. Sometimes not always for the right reasons, but they were much more interested in feelings. And so for 2 years, my main social outlets was playing on skippy rope with the girls while I was watching the lads, playing soccer on the field. And eventually my gaze went to the girls and said, there's way more going on here with interconnection and socializing. And I think, those are fairly formative years of one's life. And by the time I reached 8 and I got all my machinery off and I was able to run and jump and bike and do all the things that I do now, I've never lost that sense that being empathic is not just a feeling, it's a way of being. So I've had that feeling. I have trouble shoveling the dirt in my backyard because I'm afraid I'm going to hurt a worm. I mean, I just think everything else needs to be taken into account. Empathy for our world, for example, our environment, our temperature rising. And I think those things, have we gotten there as a culture? Well, I think we're getting there, but that's why people like us have to scream this message as much as we can.
I've been trained to listen and reflect back what I hear, the spirit of what I hear, without judgment. And so to do that, to listen to somebody, knowing that you're going to reflect back what you heard, the spirit of what you heard, you have to really pay attention and you have to be out of your own head. You have to be like centered on the other person. And that's hard work.
My job is listening. People think my job is giving people advice. And, it is to a certain degree because people want to hear my advice. But my advice means nothing if I haven't listened and appreciated them from their point of view. And, there's general advice to give to people. But when you give someone specific advice based on how you've listened to them carefully and empathize with them properly, that can change their world. Active listening is just like my definition for empathy. You have to stop listening to what you're thinking about. You have to stop listening to what you might say. Oh, I need to think this, I need to say that. You have to just relax your mind and just take it in. And hopefully that person will do the same thing when you're replying back to them. And active listening is probably is impossible in the same way that pure empathy is probably impossible. But if you try to do that and you prove that by, as you say, giving the sensibility of what somebody said to you, that person's going to feel much safer and they're going to feel much more trust in that this conversation is going to go somewhere positive. And what I do with couples, if I can very briefly describe what the colourpathy thing is, is I just use 4 colors, and it's glad, sad, mad, and frad. And glad is green, sad is blue, mad is red, and frad is just my way of saying afraid, so it rhymes, right? It's yellow. And I teach, so I've got a couple in front of me. I teach them the 4 colors and what they mean. Pretty easy to remember. And I just get them to talk to each other about whatever a recent situation is, and I'll stop them. I'll say, what color do you think your partner's feeling right now? And they say, I don't know, green. And their partner might say yes, or they might say no. I'm actually feeling a little yellow right now. And within 20 minutes, their hit rate is 90 to 95% of what each of them are feeling. Because they're now thinking, while they're experiencing that moment with each other, what is my partner? There's that sense of otherness. While I'm speaking to this person, how are they reacting? What are they feeling? And it's as simple as going on a wine tasting course, where you're picking up this wine and saying, nice oaky smoky. And then at the end of it, you're tasting things you hadn't tasted before. Because you're thinking, what more can I experience in this experience? Why not do the same thing in a therapy room with a couple? And what's interesting is that when I teach this little colourpathy thing, they take that home and they can actually check in with each other. How are you feeling? We're green, or if they're mad, or if they're feeling kind of sad. And that way they can very, very, very quickly check in emotionally, so that they're not going to bed at night sort of in a mood that's not comfortable, or more importantly, they're not going to bed at night not knowing how their partner feels. When someone knows how you feel, that's soothing. And I've always thought one of the main points of empathy is not necessarily to do something, it's to simply know how someone feels. And I was a doctor before I became a psychiatrist, and I found medicine very difficult. Not from a knowledge base, but from the empathy point of view. Because general medicine, again, I don't want to be critical here, but there's not a lot of time to be that empathic, right? If you're going into a doctor's office and you're scared and you've got pain and you've got to worry, you maybe think you have cancer or something, you know, the doctor quite understandably may have 7 minutes to talk to you. And the beauty of my office, you know, I see some people for over an hour and a half or sometimes even 2 hours per session. We can really unpeel that onion and get into what's going on with them and put it back together so they can go back to their life after that session's over. It's about creating that safe space so that someone can share how you feel. The biggest issue with empathy is self-definition. Do you get that?
No. Say it again. The biggest issue with empathy
is self-definition.
Like
this. And so what happens to us?
Empathy?
What happens is that you know, I have the prevailing sense that people probably won't understand me. They won't get me. They won't really get how I think and feel. And so if you think about it, that's kind of sad and alienating and isolating. And so when we have something that happens to us that everyone can understand, like grieving, losing a loved one, or some bad news, maybe you lost your job. When we have agreed upon social convention on what to say to each other around sadness or disappointment, again, I'm not saying that that's a good moment for anyone, but we know what to say, right? That's why we invented Hallmark cards or sympathy cards, so that we kind of know what to do. But what happens if you don't know what to do? And so what happens if something happens to you that redefines who you are and no one's going to get it? And that's what PTSD is. PTSD is when you have an experience that is outside the realm of the normal human experience that really not that many people will get. It kind of can actually alienate and isolate you. And the history of PTSD, which I've been involved in for decades now, has always been very, very frustrating because people would have PTSD, but maybe they said they didn't because we don't think that trauma is not in the book. You're not allowed to have that trauma. It took 35 years for war trauma to make it to the DSM since 1945. So, if someone has had you went to Rwanda, right? You heard of heard some horrible stories. That guy that got hidden in the floorboards, for example. Do you think you could actually know what he feels? How could he explain that to someone living in Canada, that he went through that? And so it's much wiser really to say, I have no idea how that felt for you. I'd love to hear about that, as painful as it was for you. And if you don't want to describe it, let's just talk about how you feel today. But if someone says to him, oh yeah, I know, same thing happened to me, right? We had our floors done last week. No, it's not getting your floors done. And so this is the problem. What defines us? And we have an issue, if we have an experience that defines us or changes our definition, which is what I think PTSD is. This is why you can really feel like no one's going to get me. No one's going to understand me. How could anyone understand me if I was abducted by aliens, for example? And I'm not saying that I'm going to run with that one, but I'm saying an experience that people wouldn't get. And this is another problem with sort of empathizing. This is why so many people who've had a horrendous trauma don't get therapy, because they just don't think anyone's going to get it. They don't think anyone's going to believe them, understand them, appreciate them, let alone empathize with them. You see what I'm saying now about the definition issue?
Yeah, I do. And it kind of makes me think about my own definition of empathy, right? So I talk about empathy as the innate trait that unites us in our shared humanity, with the caveat that it doesn't deny or discount lived experience, because we can't ever really, really, really know what someone else has lived, right?
That's right.
But if we're not projecting how we would feel in their circumstances, and we're actually really trying to discern how that experience is unfolding and being lived by the person, that's when we are entering a state of empathy, according to you, yeah? Mm-hmm.
According to me, you're truly empathizing with someone when you're not thinking, well, how would I react in that situation? What would I be going through? And I always say, if two people both have bald heads and they're going to the top floor of a cancer clinic and they both had cancer and they've got their treatments and they look at each other, it would not be empathic to say, I know exactly what you're going through. It would be empathic to say, We may have some things in common. I can certainly sympathize with what you, but I'd love to hear what you're going through that's unique to you. That's the empathic question. Mm-hmm. And that to me is when empathy starts to open up. And I realize in psychiatry that if you ask someone people questions to get them in the book, no, that's a perfectly acceptable thing to do. But what about someone, what about the rest of their life? What about what's happening outside of that headache that they're there? And I realized that there's so much more to human being than a Post-it card. We're novels. Human beings are walking stories, and that's why books are important. Books are empathizing with the writer. If something's written well, they're putting a bit of their soul into their words, and you're actually getting a chance to see that and experience it. Obviously, from your point of view, that's why the movie is never the same as the book, because you've imagined something different than somebody else has envisioned when they're putting the movie together. So I constantly try to redefine empathy as negating self, and it's the same with active listening, and just trying to experience that person from their point of view.
That's beautiful. Okay, I have a couple little questions to ask still, if you have the time. I want to ask you how empathy is used in the diagnosis and treatment of psychiatric conditions, and if you think PTSD is an empathy disorder.
Well, I think that's a great question, first of all. I think that when you really know how someone functions psychologically, and that means in their mind, in their soul, in their spirit, sociologically with their world, and how they fit into their universe, you're in a much better place to make an accurate diagnosis of what's going on with that person. So I remember when I was working at the hospital back in the 80s, Peter Gabriel had just released a song called Red Rain. And I'm a Gabriel fan. And one of our patients in the hospital was muttering, "Red rain, red rain." And the psychiatrist who was teaching me how to be a psychiatrist came up to me and said, "We better get that guy's meds up because he's going on about red rain." And I just thought, oh my gosh, he doesn't know about, just ask what is red rain? Oh, this is a great Gabriel song on the radio. If you assume to know what you think you know, and then you move forward with an action that might change someone's life in this case, based on a presumption, you're actually not empathizing. And so I think for me, psychiatry is asking as many questions as you can so you can comfortably make someone feel as if you get them. And a person will tell you, "I think you get me." And I hear that all the time in my sessions with people. And I don't want to sound arrogant because I know that sometimes I can. A lot of my clients say, "You get me so much." And I'm thinking, yes, because I'm giving them a feeling that maybe they've not had in their life ever, that someone gets them. And that is healing. It's a soothing and healing experience for someone, especially if they had shame trauma in their childhood and they've hidden that their whole life. Now they're in their 40s, they've decided finally to come to therapy, and you're unpeeling the story for them. And they're terrified that they're going to be rejected. And they say to you one day, "You got me. That's why I began to get better."
Mm-hmm. That's so cool. So then empathy and PTSD.
So like I said, if someone is just going along with their life and something happens that changes the definition of their life, if they're mugged, robbed, assaulted, held hostage, in a plane crash, that moment becomes something that now redefines their life. And if that experience cannot be empathized by other people, or if that person believes that no one will be able to understand this experience, just pick a combat veteran coming back from tour of duty, coming back to a little town where there's a corner store, and nothing's the same. Right? They will go into a shell, and they will essentially not be able to function properly because they're having symptoms, but at the same time, they don't think that anyone could understand this redefinition of who they are as a person. And what happens when you actually enter that place with that person, especially if it's shame-based, and help them understand this redefinition, help them to accept those parts of themselves that have been alienated from themselves on the inside, and allow integration to happen. There's an issue of forgiveness and self-empathy as well, which is maybe not time to talk about today. But it's so amazing to watch them begin to come together and just come together. And just like that octopus in that octopus movie, where it's just reaching out and finally it connects, and when you see people do that with themselves, they finally connect. And now their definition of themselves is safe again, then you know that their PTSD symptoms are going to begin to resolve.
So would it be fair for me to assume that you're not a big fan of the whole over-medicalized psychiatry industry, and that you think, that talk therapy can go a long way?
I'm an anti-psychiatry psychiatrist, which means that I think that the talking cures are still very powerful. I do prescribe medications. I'm not saying I don't, because they absolutely do help in lots and lots and lots of cases. But for me, if I'm going to help someone, I can give them the dust jacket of the book, or I can give them the dust jacket and the book. And I think in this case, therapy, more is more. And that means if someone feels more understood by me, I'm in a much better position to make the right clinical decisions on how to help them.
This has been a fascinating conversation. I'm so grateful for the time you've taken. I want to ask the final question, which I ask of all my guests. And that is, can you think of a time in your life where you've been on the receiving end of empathy and what that has meant for you?
Well, I've been nervous about telling you this. And if this doesn't work for your program, then that's just too bad. So I was swimming in Mexico, snorkeling. I was with a group of people. And, they were there, maybe 20, 30 people in the water. It was a warm Mexico day. And I swam off a little bit by myself. So now I'm in the middle of the ocean. And I see this little black thing coming towards me at great speed. I've got a snorkel and a face mask on. Suddenly, I realize I'm being circled by a 6-foot barracuda with teeth this long, and its big black eye rolling around. And I just calm myself down. I follow it as it's going around the circle. We make direct eye contact that felt like a day, but really was probably only seconds. And I actually felt, I'm going to sound bizarre, I felt like we communicated. And it looked at me and said, okay, this guy is not food. I looked at it and said, this guy is not going to hurt me. And it swam off just as fast as it came into me. And for that moment of this fish swimming around me, I felt this profound connection with it at that time. And when I saw the octopus movie, my octopus teacher, which I bawled all the way through, I said, I've had an experience like that. Can we empathize with things that are not other humans? Of course we can. We can empathize with all kinds of things. And there's many, many creatures that are incredibly empathic, like bonobos, for example. They're very empathic primates. And so I think that experience has never left me. I'm not sure if that's what you were looking for, but it teaches me that the empathy is everywhere. It's everywhere. It's just waiting to be found and experienced, really.
That was a beautiful story, and that's why I love to ask this question. So thank you so much, Ashok. It was great to meet you and have this conversation.
My pleasure.
And I want to thank all of our viewers and listeners, and we'll see you next time at Purposeful Empathy.
What if you had access to your own council of coaches to help you break free from your thinking clutter, or make an important decision, or liberate you from whatever's holding you back? At Grand Huron International, you get to choose the coach of your choice from any place, anytime. Visit grandhuroninternational.com and harness the power of on-demand coaching today.